Welcome to this overview of the Comprehensive Class Member Transition Program Assessment Requirements provided by the UIC College of Nursing. This presentation is designed to provide comprehensive program staff the information needed to complete assessment requirements. Comprehensive Policy P2.1 Assessment states that after the initial assessment is completed, ongoing assessment updates should be reflected in the class member's comprehensive service plan. If the prime agency is using an assessment tool that requires updates, such as the IMCANs, the updated assessment should always be uploaded to the web app. Agencies must use an approved assessment tool to conduct assessments and document required components within the CCMTP web app. The assessment must be completed face-to-face with the class member by a qualified professional, as defined by the comprehensive program. It may be necessary to spread the assessment over multiple sessions. This should be documented in the assessment when required. Make sure that informed consent has been obtained before beginning the assessment. The Facility Records Request document is a helpful document that standardizes records requests given to nursing facilities and SMRFs. This can be helpful through the pre-transition process. Check the boxes indicating the records you would like to obtain from the facility, including any other requests. Attach the member's signed consent to release information to this document when providing it to the facility. Be sure to specify a deadline by which you need to receive the records. Once referred for assessment from outreach, the assigned care manager must initiate an assessment of the member within 14 days of this referral. The corresponding section in the web app must also be completed. All assessments used by prime agencies must be approved by IDHS before use. All assessments must be typed and completed on the approved assessment template. Assessments must include, at minimum, the following: date the assessment was initiated, date the assessment was finalized, assessor name and credentials, information regarding power of attorney and guardianship, physical health components including diagnosis, medication, laboratory work, and information regarding hospitalizations in the last 6 months, behavioral health components including diagnosis, medication, hospitalizations within the last 6 months, and historical symptoms including suicidal ideation, homicidal ideation, aggression, and psychosis, substance use including any history of use, type of substances, age of onset, frequency of use, and consequences of use, and functional status including specific ADL and IADL needs, ambulation challenges, DME needs, and cognitive deficits challenges. If current lists of medications and laboratory diagnostic testing is available, these may be uploaded as their own document into the member files and signed document section of the web app. Before starting the assessment, review the class member details and update details where indicated. Components within this section include primary information, such as name and birth date, secondary information, such as marital status and pronouns language, and additional class member needs and accommodations, and payer insurance. After the details are reviewed and verified as current, click Update on the top or bottom of the section to save the changes made. Once this section is reviewed, proceed to assessment using the links on the right-hand column of the page. The assessment should be conducted in the member's primary language, so if this is not a language that the assessor speaks, an interpreter should be used. Generally speaking, family members or friends should not be used as interpreters, and agencies should have policies in place for providing services to members whose primary language is not English. The UIC communication tool is also helpful for completing the assessment with members who may have difficulty with speech. It provides pictures and icons that can be used to facilitate communication with members, and is specifically designed to support the assessment tool. If there is any other type of accommodation needed for the assessment, document this within the web app. There are several required entry areas in the web app, including class member information, challenges, condition status, which include diagnosis, medication, and functional status, summary, and outcome. Remember, primes must attach their completed approved assessment tool to class member files in the web app. The first section of the assessment, class member information, covers some basic information about the class member and their engagement in the assessment process. It must be completed for all members that are identified for assessment and/or have an assessment attempted, whether or not they proceed to the full assessment. This includes members who are deceased or who have transferred to another facility. In the web app, select the type of assessment being completed. This is most often an initial or first assessment, but could also be a reassessment for a class member with a previous attempt. The assessment date reflects the date the effort was made to complete the assessment. In most cases, this reflects the first day the prime meets with the class member to complete their assessment. In cases where class members are no longer at the facility, or the class member does not proceed to assessment, this reflects the date the prime made the effort attempt. Note, this is the date of the agency assessment, not the date the prime is completing the online documentation for the CCMTP. Prime agencies are responsible for ensuring the agency's completed assessment is uploaded to the member files. This section also captures if the class member is still in the facility, is able to engage, and if they are still interested in the program. Assigned informed consent is also verified in the web app. The intention of this section is twofold. First, to document assessment efforts for all class members identified for assessment. Second, to determine if the class member identified can and will proceed to the remainder of the assessment. This section is completed before documenting the remainder of the assessment. Based on the response and class member information, you will identify if the class member is not proceeding to assessment and therefore not proceeding towards a community move. If the class member is not proceeding, you'll provide additional information to reflect why. Once you have completed the related assessment documentation, you will indicate the member is no longer proceeding within the web app. Things that are important to note in this section are general concerns about the assessment and transition process, indication that the facility staff may be encouraging the member not to move, or if the member's family does not support the transition. You can also include a summary of any comments or concerns that arose during this initial portion of the assessment. If the member has a legal guardian, stop here and make sure you have legal authorization to proceed. Obtain the contact information for the member's guardian from the member or the facility and reach out to them to explain the comprehensive program, report the member's interest in assessment, and ensure that consent to proceed is obtained. In the comprehensive program, this informed consent should be obtained from the guardian at the outreach stage of the process, but must be verified before proceeding to assessment. This is also a great opportunity to obtain collateral information from the guardian about the member's abilities and limitations. Ensure that the guardian consents to proceed with the assessment and has signed any needed releases before returning to talk to the member. Some other general advice for working with guardians. The best practice is to review your recommendation to proceed to transition or not with the guardian prior to discussing it with the member. This ensures that there is no confusion on the member's part about the next steps. Guardians can still refuse to proceed with transition if they do not believe it is the member's best interest. If the guardianship is through a government office, like the Office of the State Guardian, you can seek out a supervisor if the member's assigned caseworker is unavailable. It is also helpful to review the class member information at this time on the member page. This includes certain demographics such as race, ethnicity, identified gender and pronouns, language and accessibility needs, and other information that may be helpful as you proceed with the class member engagement. The care manager can then proceed to the review summary. Finally, the assessment outcome is selected. Options include member declined to proceed, indicating the class member or legal guardian made a choice to not continue towards transition. Assessment started, but incomplete, indicating the class member did proceed to assessment. Past class member information. but was unable to complete the assessment due to factors such as decline, discharge, death, health status, treatment barriers, or hospitalization. Proceeding towards transition, indicating the class member will continue with service planning. Once all information is entered and verified, finalize the assessment through the box and assessment outcome. If the class member is not proceeding, close the case through the appropriate details in the No Longer Proceeding feature. Ensure the same reason is selected. For example, if the assessment indicates the class member is not proceeding due to death, death should also be chosen. Current versions of all comprehensive program policies and forums, as well as educational resources, can be found on the Colbert-Williams training website managed by the UIC College of Nursing. Any questions can be directed to the Colbert-Williams Help Desk email listed on that website. Thank you for your attention and efforts to ensure safe and successful member transitions.